Hello and welcome to the COMLEX Instant Review. Today we're talking about the osteopathic treatment in genitourinary conditions. This is a high-yield topic, and understand that manual treatments most useful for Part 2 exams are mainly those that deal with normalizing the basic mechanical strain patterns in the sacral, lumbar, thoracic, rib cage, cervical, and cranial regions, usually muscle energy techniques, post-isometric if chronic, and reciprocal inhibition or oculocephalogyric if acute in cervicals is recommended. If you're using myofascial, then direct if chronic and indirect if acute is recommended. And understand that doming of the diaphragm and lifting the mesenteries, as well as strain counter strain, if some tender points are present, and HVLA for a strong articular component can be used. So that's just a general overview. The basic overview you want to keep in mind is normalizing the mechanical strain patterns in the sacral, lumbar, and thoracic, rib cage, and cervical and cranial regions. So how do you normalize the sympathetic tone? Well, usually physicians tend to use inhibition in the thoracolumbar region, myofascial release, and also Chapman's reflex point treatment. So traditionally, posterior points are used for treatment and anterior are used for diagnosis. So keep that point in mind. However, the points found in the iliotibial band are also useful. So there's several things here that you want to keep in mind. To normalize the parasympathetics, usually cranial treatment using CV4 technique, and careful attention to correct any OA and AA, as well as sacral and pelvic dysfunctions can be applied. Now remember that to improve lymphatic drainage, usually addressing the diaphragms, such as superior thoracic aperture, that is the thoracic outlet, the respiratory diaphragm, the inferior thoracic aperture, and the pelvic diaphragm, and addressing these regions to improve the lymphatic drainage is recommended. When infection is present, then splenic and hepatic pumps may be indicated unless there's some kind of an organomegaly or friability of the viscera. If any lymphatic pumping is to be performed, it would be the last maneuver performed in a treatment sequence. So keep these facts in mind. They're generalized facts on how to approach patients with genitourinary tract conditions. Visit COMLEXflashcards.com and good luck in your preparation.